Do you personally believe that life begins at conception? And if not, when does it begin?
You know, this is something that I have not, I think, come to a firm resolution on. I think it's very hard to know what that means, when life begins. Is it when a cell separates? Is it when the soul stirs? So I don't presume to know the answer to that question. What I know, as I've said before, is that there is something extraordinarily powerful about potential life, and that that has a moral weight to it that we take into consideration when we're having these debates.
Let me go to, again, the end of the spectrum on that. There are a lot of philosophical and ethical questions relating to ending one's life. In The Audacity of Hope, you write very movingly about your mother's fight with cancer, the pain she was in, and the process that she went through, especially toward the end. In that vein, if someone today was in her position and wanted to take active steps to end his or her life, do you think that would be okay, morally?
Well, I think we have to be very careful in making end-of-life decisions. I believe in, first of all, everybody having a living will, so that their views on these issues can be factored in by family members and their doctors. And many of the difficult choices that are made because people don't have guidance from the individual. I do believe in the importance of palliative medicine, and that if somebody is terminally ill, relieving their pain and suffering is the right thing to do. What happens then is you start getting into a gray area where relieving pain and suffering may accelerate death in some situations. And that is a choice that I think should be made by the individual, the family, and the doctor. I don't think that it's appropriate to empower doctors themselves to make that decision. But I think that it is important for us to be able to allow people who are terminally ill, in excruciating pain, to get the medicine that they need to relieve that pain.
And by relieve that pain, you mean hasten the end of life, if they choose to.
Yeah, and I think that there have to be very strict guidelines to ensure that somebody who's making a decision to relieve their pain that might take a week away from their life just because they are slipping into a coma quicker, for example, that is distinguished from, or at least there's a possibility that they slip into a coma, that's distinguished from euthanasia, in which somebody else is making a decision for them.
Let's go to Dr. Frank Page, who's with us, president of the Southern Baptist Convention. Dr. Page.
Thank you, Senator Obama. Thank you for being here at Messiah College for the Compassion Forum. Southern Baptists have been very active for years in sub-Saharan Africa in the HIV/AIDS relief ministry, sometimes orphan care, sometimes educational activities. But we also are involved in a ministry called True Love Waits, which has been credited by the government of Uganda from lowering the AIDS infection rate there dramatically from 30% to 6%. But we also teach a part of that faith has a role in the issue of HIV/AIDS. Do you concur with that, and would you elaborate on that, please?
Can I just clarify, too? True Love Waits is an abstinence program. That's
abstinence-based and faith-based, yes.
Well, first of all, congratulations to those who've been involved in that work. I think it's important work, and I think you may know my father came from this part of the world. I've visited Kenya multiple times. I've been working with a group of grandmas who are helping AIDS orphans in Kenya. Michelle and I, when we were traveling there, took an AIDS test before thousands of people to encourage the importance of them getting clear on what their status was and hopefully reducing infections. And by the way, this is an area where this doesn't happen very often, so everybody should take note, where I compliment George Bush. I actually think that I actually think that the PEPFAR program is one of the success stories of this administration. We've seen a drastic increase in funding, and terrific work's being done between the CDC, the NIH, local AIDS organizations, NGOs. My view is that we should use whatever the best approaches are, the scientifically sound approaches are, to reduce this devastating disease all across the world. And part of that, I think, should be a strong education component, and I think abstinence education is important. I also think that contraception is important. I also think that treatment is important. I also think that we have to do more to make antiviral drugs available to people who are in extreme poverty. So I don't want to pluck out one facet of it. Now, that doesn't mean that non-for-profit groups can't focus on one thing while the government focuses on other things. I think we want to have a comprehensive approach. I do think that, and I said this when I was in Kenya, that there is a behavioral element to AIDS that has to be addressed. And if there's promiscuity, and we are pretending that that's not an issue in spreading AIDS, then we're missing part of the answer. But I also think that, keep in mind, women are far more likely to be infected now between the ages of 18 and 25 than are men. And that's why focusing, for example, on the status of women, empowering women, giving them microbicides or other strategies that would allow them to protect themselves when they sometimes in certain situations may not be able to protect themselves from having unprotected sex. All those things are going to be just as important as well.
Sir, on an earlier occasion in talking about your own daughters and talking about sex education and contraception, you said that you would not want your daughter punished with a baby if she made a mistake, that you would teach values and morals, but if something were to happen. The phrase punished with a baby was jarring to a number of people. Could you explain what you meant by that?
Well, keep in mind, on that same day I said children are miracles. And so I think it's important not to parse my words too carefully here. What I was saying was that my daughters are 9 and 6. And so if at the age of 12 or 13 they made what I would consider to be a mistake in having sex or unprotected sex and ended up getting pregnant, I think that statistically we know 12 or 13-year-olds who are having children are much more likely to be impoverished, are much more likely to be have health problems, are much more likely to have trouble raising that child. And so all I meant was we want to prevent teen pregnancies, and what we don't want to do is to be blind to the possibility that kids will screw up. Just like, surprisingly enough, we as adults screw up sometimes. And that we should factor in the possibility that they make mistakes in our approach to dealing with STDs, which is what I was being asked about at the time. And we want to make sure that even as we are teaching responsible sexuality and we are teaching abstinence to children, that we are also making sure that they've got enough understanding about contraception that they don't end up having much more severe problems because of a dumb mistake.
Senator, if one of your daughters asked you, and maybe they already have, Daddy, did God really create the world in 6 days? What would you say?
Yeah, I'm trying to remember if we had this conversation. What I've said to them is that I believe that God created the universe, and that the 6 days in the Bible may not be 6 days as we understand it. It may not be 24-hour days. And that's what I believe. I know there's always a debate between those who read the Bible literally and those who don't. And that, I think, is a legitimate debate within the Christian community, of which I'm a part. My belief is that the story that the Bible tells about God creating this magnificent earth on which we live, that is essentially true. That is fundamentally true. Now, whether it happened exactly as we might understand it, reading the text of the Bible, I don't presume to know.